I guess Patrick will be ready. Oh, Patrick's right there. All right, so I have 10 o'clock, so we'll go ahead and get the meeting started. As always, I want to thank everyone for their time, effort, and participation in our work before us today. We want to recognize that this is very difficult and important work, and that we appreciate and value the perspectives and professionalism that everyone brings here today. Thank you. So starting off, roll call.
Okay, Sarah Merritt.
Good morning.
Good morning. Ryan Hearn.
Ryan's going to be a little late.
Oh, okay. Okay, great. Let's see. Co-Chair Strickland.
Present.
Stacy Lewin. Present. Lauren Bowling.
He will not make it.
Okay. Let's see. Co-Chair. Oh, pretty sorry.
That was both.
Emily Cronin.
Present.
Okay. Kim Schlesinger. Present. Yes. Director O'Day. Will he be here? You know? Is he online? No? Okay. I will just ask him right now. Okay, we have a form.
Great. So first up, I know we try and hold some space in every meeting for public comment. My understanding that we don't have anyone pre-signed up, but I wanted to give a moment just in case anybody felt inspired online or in the audience. Not seeing anything. So next up on the list is a review of minutes from November 6th, which have been provided to everyone.
I would move approval of the minutes as submitted.
So we have a motion. Do we have a second?
Second.
Second. Any discussion? Not seeing any. All those in favor signify by saying aye.
Aye.
Any opposed? Any abstaining? None. So next up, I see department updates, starting with the Workers' Compensation Board updates from Lauren Eldridge. Take it away, Lauren.
Co-chairs, members, thank you for having me today. I have a quick update on an Oregon Supreme Court case that issued recently.
Lauren, just a second. We're getting up the PowerPoint for you, okay?
Fine. Okay, thank you so much.
I'll turn it for you. Okay, Lauren, can you, okay, we have the PowerPoint. Can you just say something real quick so I make sure I have the volume correct?
Can you hear me?
Is that better? Yeah, it's a little muffled. Okay, there we go.
Better now.
It's to you. Go ahead.
Okay, thank you, Terry. Okay, so the case is Titleman versus Safe. Some of you may recognize this. I provided an update when the decision from the Court of Appeals issued in this case, but we now have the final word from the Supreme Court. So today I'll be stating on that. Next slide, please. Thank you. Okay, so this case concerns, just as a refresher, this case concerns a worker requested medical examination. So, or a WORMI, as we commonly refer to it in the workers' compensation universe. What is a WORMI? A WORMI is a medical examination of an injured worker. It's performed by a doctor appointed by the DCBS director and paid for by the workers' compensation carrier. Now, a worker is entitled to a WORMI under statute and administrative rule if three requirements are met. The first is that there's a denial of the compensability of the worker's claim, and the worker timely requests a hearing on that denial. The second is that the denial is based on a report or reports of an independent medical examination. And the third is that the worker's attending physician does not concur with the independent medical examination report or reports. So the Titleman case, you might remember, deals with the second of these three criteria, that is whether the denial is based on the report of one or more independent medical examinations. So for anybody that might not know, an independent medical examination is a medical examination that the carrier, the workers' compensation carrier, can require an injured worker to attend. And then the examiner will provide a report to the carrier that the carrier can then use for its decision on the claim. So next slide, please. Okay, so prior to the Titleman case going to the Court of Appeals, the board's position on the second element was that a denial cannot be based on an independent medical examination report if the examination and the report occur after the denial is issued, like in time. So there's a couple cases where the board held that, including this one. Next slide, please. So that brings us to this case. Just a really quick rundown of the facts here. The worker in this case filed a claim for a low back injury and the carrier denied the claim. After the denial, and the worker requested a hearing on the denial. After the denial issued, a doctor performed an independent medical examination and issued a report that was supportive of the carrier's denial. The carrier then indicated that it intended to rely on that independent medical examination report in support of its denial at the hearing, and then later introduced that report as evidence in the hearing proceeding before the administrative law judge. Next slide, please. So in evaluating the worker's request for a WRME, the board held, consistent with its prior cases, that the denial here could not have been based on the independent medical examination report because the examination and the report occurred after the denial was issued. So the worker appealed that decision to the Oregon Court of Appeals. Next slide, please. And the Court of Appeals disagreed with the board and reversed. So looking at the statutory scheme, the Court of Appeals said they really didn't see where the text or context of the statute limited WRME eligibility to only those circumstances where the denial happened after the independent medical examination and report. The court also noted that the purpose of the WRME statute was to provide the worker with additional medical examination where the existing medical evidence was not in concurrence, and that purpose would be frustrated by a limitation on WRME eligibility based on the timing of the independent medical examination. So in the particular case, the court held that because the carrier had submitted the independent medical examination report as evidence in support of its denial at the hearing, the denial was based on that report for purposes of WRME entitlement. Okay, next slide, please. So the carrier then appealed that decision to the Oregon Supreme Court, and the court took review. We now have a decision from the Supreme Court. So the Supreme Court agreed mostly with the Court of Appeals and continued to reverse the board on this. So the rule of law to really take away from the Supreme Court decision is that a denial is based on an independent medical examination report for purposes of WRME entitlement if the denial is based on that report at the time the worker's WRME request is decided, not at the time the initial denial issues. So a couple really important points that the court used in deciding, in reaching this rule of law. The first is that the court really characterized a denial not as something that starts and ends at the time that the written denial is issued, but as kind of a living status. So a denial of compensability is something that continues throughout the claim and can in fact change throughout the claim and the course of litigation. So accordingly, a denial could be based on something that happened after the denial was initially issued, because the denial is sort of this continuous status. Second, the court really did a deep dive into the legislative history of the WRME statute and found that the overall purpose of the WRME statute was to make the medical exam process more fair and impartial. And the court reasoned that creating a limitation on WRME eligibility based solely around the timing of the independent medical examination and report would really frustrate that purpose and not create the impartiality and fairness that the legislature really intended in adopting the WRME statute. Next slide, please. So turning to the facts of the specific case, the court held that because the carrier had indicated that it intended to rely on the independent medical examination report at the time that the worker's WRME request was decided, that at that point, the denial was based on the independent medical examination report for purposes of WRME eligibility, and that the worker was entitled to a worker requested medical examination in this case. And that is all I have. Are there any questions?
Not seeing any.
Oh, okay. Thank you.
Great. Thank you very much. I take it that includes the WCB report. That's just the one that's attached. Okay. Thank you. And next up, I see Workers' Compensation Division updates. Harry.
I'm gonna pass it over to Administrator West.
Good morning.
Welcome.
This won't be nearly as interesting or technical. You're all now WRME experts, so that's good. So I just had a couple of personnel updates. I don't know if I can defer to Sean if you want to talk about your new deputy.
Go right ahead, man.
Okay, yeah, so we just got an announcement that Alana Cox, who is currently the Building Codes Division Administrator, which is one of the divisions within DCBS, she's going to be the acting DCBS Deputy Director starting January 1st. Since Sean's now permanent, so just wanted to give you all that update. And then update more related to MLAC. So we have Stacy Saunders with us. Sanders. She's helping support the committee for the foreseeable future. Baba took a job rotation up in another area, so she's learning some other parts of the agency. So Stacy joins us she's currently with us, but was with the Division of Financial Regulation. Yeah, DFR, one of our other divisions. So we poached her from them, so she'll be here providing support. So that's all I have.
All right, great. Thank you. Congratulations to Baba. Welcome, Stacy. Next up on the list, I see MLAC 2025 accomplishments.
It looks like this, everybody.
Welcome back this week. It's me again. Thank you. Yeah, so you should all have in your folder. It's kind of neat at the end of the year to take a look back and see, everything that the committee has accomplished. Probably, felt like you were in a lot of meetings, so it's good to kind of put on paper. So I'll just kind of walk through it. As far as meetings and engagement, we had 17 full MLAC meetings held throughout the year. One very interesting one that we won't talk about, but
It was canceled.
that was canceled. So I don't know if that was included in the 17.
Oh, my first one.
Yes.
Welcome, Emily.
Yeah. So great.
In addition to the full MLAC meetings, we held 17 subcommittee meetings, which included the Access to Care Subcommittee and the Temporary Disability Rate Subcommittee, or average wage. And both subcommittees developed and submitted recommendations to the full committee last month. Our public participation in MLAC meetings continued to be very strong. We averaged over 55 attendees from the public for our full MLAC meetings and over 35 attendees on the subcommittee meetings. So that's pretty awesome. As far as the legislative impact that MLAC had this year, so you all reviewed 15 bills that were relevant to workers' compensation. You sent support to the legislature for 5 of those bills, and then referred 2 other bills to subcommittees that I just mentioned. 4 of the bills that MLAC supported became law: House Bill 2799, House Bill 2800, House Bill 2802, and Senate Bill 904. The MLAC co-chairs presented at the interim House Committee on Labor and Workforce Development during these September legislative days, presented on kind of an overview of MLAC and your process. There were a lot of new members on that committee, so it was a good overview for them. And then in the November legislative days, the MLAC subcommittee co-chairs gave an update on to the interim Senate Labor and Business Committee. So a lot of activity over at the legislature. During session, there were 3,466 total bills. Terry had to read every single one of those and determine if they had any sort of workers' compensation impact. So she was very busy. Of those 3,466 bills, WCD tracked 183 that had a potential impact to workers' compensation. That was during the 2025 session. Other activities through the committee throughout the year, you all heard reports on the Workers' Benefit Fund, the biannual permanent partial disability report. We had a report or a presentation on exclusive remedy at the request of the committee. The Oregon Institute of Occupational Health Sciences did their annual presentation in October. And then we also had some additional information shared about the Workers' Benefit Fund. Community outreach this year, we had a very successful in-person offsite MLAC meeting with the town hall that was in Bend as part of the OSHA conference over there with the social hour where you all were able to engage with local stakeholders and the public. We heard really good things about that. We're already working with OSHA to plan next year. So that's the second year that we've done that. We were in the Dalles the year before and then Bend. So we're looking for another location. So just, it's important to look back and see all the work that you all done in addition to your real jobs. So this is all the volunteer work that you did. So I know I can speak on behalf of the division and just on the behalf of the Oregon Workers Compensation System. We thank you for all your hard work, support, the hours that you volunteer to help ensure that Oregon's system remains one of the best. So thank you. Happy to answer any questions or elaborate on anything. Terry put this together. So thank you,
Terry's
Terry.
daughter put this together.
Terry's daughter.
Terry didn't put this together.
All right. Thank you.
Thank you so much to you for your leadership, to staff as well for all of their support, and members of the public. I know it was invaluable in the subcommittee that Stacy and I worked on. We could not do this work without the support of the public and stakeholders online and in person as well. So just wanted to take a moment and thank you all for that as well. So great. Next up, I see MLAC work plan updates 2025.
Yes, so I updated the table and the list of topics. I was trying to think the last time we looked at this. It's been a minute, right? So this is just for your information. I don't know if you had a chance to review it before the meeting, but wanted to give you an opportunity to provide any feedback before we start the short session coming up. So if you didn't have a chance to, we can walk through it, or you can let me know if there's any edits or if I got everything already. Just wanted to hand it out and let everybody have a chance to go through it. So there's the table format, and then we have the list as well. So
I see one question.
sure. Yes.
When we are talking about the healthcare summit for access to care, are we thinking after short session? Okay.
Absolutely.
Just want to double check. It says spring, so I want to make sure. Thank you.
Yeah. Also, I've been talking to, the stakeholders and people that we work with, and just kind of putting the word out there. We're looking at this. It'll probably be April, May, June. So people are aware. I don't know if you've been talking to people, but I just wanted
People
to.
have been talking to me. Yeah. So yes. Okay.
Yeah. So talked with our folks up in DFR, let them know what's going on. I talked with our friends at SAFE, let them know. But they had been in the meeting as well, this subcommittee meeting. So trying to share when I see people, let them know the intent. So.
Any other questions or
I
comments?
mean, maybe just a question on that one. So is that something that MLAC is like coordinating, or we just are participants, or?
I think we're coordinating it, but we're one small piece of that puzzle. So we're gonna need others to help with that larger summit, because we know the workers' comp provider piece of it, but there's so much more to it. So, I'm sorry, I don't know that I answered your question, but there's a larger piece to healthcare, and we can't figure it out all on our own. So we're
Sure.
gonna need help from others to put this summit together.
Yeah, I think that's more, you got to my question, was like,
Okay.
it kind of seems beyond us, you know, like we have a piece, but we're not all of it. And so I don't know, we did say we were volunteers.
Yeah.
We are. So, I don't know, I want us to set expectations right. That's it.
That's a good point. Any other questions or thoughts? I know this is very much a living document to be revisited. I know Sarah typically has a lot of, thoughts and input on this too. So we may have feedback kind of through co-chairs or direct to you, Terry, on
Okay.
thoughts as well, and can revisit this in the future too. So great. Any other questions or?
Yeah, me again.
Yes.
Sorry. Do you envision, and maybe you haven't thought about it yet, but the regulatory tour being in conjunction with this or separate,
You know,
different
that
timing?
is something that we've talked about, because we have all, we have OSHA, we have DFR, we have all these different divisions within DCBS. We just never got to it because we have other things that take precedence. So really need to flesh that out and work more on.
Okay.
So it would be great to have that regulatory tour. Timing.
Right. Okay.
So.
And
So, do we need to discuss priority-wise, like, and again, the regulatory tour isn't necessarily being driven by us, right? But I just don't want to put a work plan together that has these really lofty goals that we just keep moving to different years. And so it does sound like the healthcare summit is a priority, not necessarily just for MLAC, but in general with the changes we're seeing in reimbursement structure and some of the problems we're seeing, especially in rural areas. Are we prioritizing that above the regulatory tour? Should we talk about that?
I think I see your point. I would say I don't think that these are listed in any particular order, and if they are, I agree with you. They should definitely be reshuffled.
Yes. Yes.
But I think it was more just kind of a list of all the different educational topics. I would agree with you. I think we have some great momentum around the work that the Access to Care Subcommittee did. We want to make sure that we're continuing that forward. And I would say that the Healthcare Summit and Access to Care in particular is a high priority. Open, this isn't just my committee, so open to any other input on that. But
I think also, Emily, the Healthcare Summit does say spring 2026, where the regulatory tour just says upcoming. So.
Oh, sorry, it says spring 2026, but I see what you're saying. Basically, I just wanted to ask, or at least bring it up for discussion or thought, that like, what I want to see at the end of the year is that the work plan actually has some check boxes on it, that we're not creating these really lofty, necessary, but lofty due to capacity goals that we just keep on this thing forever.
Yeah.
And so if we decide that the regulatory tour sounds like a great idea, but it's not something we think we can accomplish as far as capacity where we're participatory, then I would move to take it off to like a wish list under here so that we're working through the actionable items. I would like to see the work plan change every year, not just keep like my normal to-do list and just keep moving stuff month to month to month. So.
And we have moved some things off this work plan. So there are things on here that have been moved. So and we can move the 1, 2, 3, 4, 5 around to where it's more in line with what we're doing. Because we have done the exclusive remedy presentation, worker benefit presentation, So I just wanted you to see what we have done this year.
Yes.
So, and then update it, and then we can move it.
Okay.
Yeah, that's not a problem.
Thank you.
What is the regulatory tour? I guess I don't remember exactly what our goal is
I
with that.
think Director Stolpe brought it up and talked about how each division could come in and give a little presentation about what it is that they do.
I think it was partially the kind of perspective analysis of the panels that we had, where we had the kind of insurer panel, the injured worker panel, I think employer
Yes.
protection is part of that, but having the kind of different perspectives of the different sort of players and interests involved in the work comp system. And I think we talked all about having kind of a regulatory perspective on that as well. Partially to allow stakeholders and others to kind of understand the differentiation, where WCB is, how they kind of fit in, what OSHA is responsible for with the coordination and collaboration between them and all of that. And I know DFR to some extent with the, insurance angle there potentially as well. So I think that was the one that we were sort of least clear on how to structure and who should be involved and when that should be presented, which I think is one of the reasons why it was kind of punted on for a little bit as session came up and we started being involved in all of that, and then worked our way through the summer of subcommittees, as I believe it is. So I think that's sort of a final pendant piece of that sort of perspectives on work comp, which again, I think to Emily's point is not a priority compared to some of the other things that we're working on.
Yeah, I agree with you, but I think it is a good thing. One comment I would make is on the time frame, maybe putting dates for some of these. Like, I agree that some of this is more of a priority, and I feel like that came from when we went to our public meeting. It kind of came out there, like that was something that just general public across the state, that's an important thing. I don't know if, I wasn't part of the subcommittee meetings, but I just, in another committee that I'm on, they were talking about physician assistants. And that, like, expanding that within work comp, and it was just something I heard there, but I haven't seen a bill come through. Is that kind of one of the things that you're looking at, like having additional providers? Yeah.
Yes, I mean, there are two different bodies that sort of regulate the scope of PAs and NPs. And so while they operate to the end user, the injured worker, similarly, as far as how we receive care, their regulatory components and kind of what their scope is very different. And so I'm not sure if there's intending to be a bill that is encompassing of both, or if it's going to come as two. I haven't discussed that with the powers that be, basically Jack. I don't know, but yes, part of the idea of the expansion of access would be to increase the number of providers that are available, especially in rural areas where we see predominantly PAs and NPs take on roles as like the primary care component for that community.
Then I think the regulatory tour seems important. I know a lot of times we'll get invitations to things like rule making and all kinds of stuff that seem like byproducts of things we approved. And I'm like, well, I wish I had time to listen to that or know how it carries out, and I don't know. So I think it would be nice to kind of understand that. But later, after the session and in that kind of lull period that we have. And could you put dates on the thing? I know this is something, Sarah's in my head. Sarah always has good comments. But that, we do the annual worker benefit fund at a certain meeting.
Okay.
And the health science people, they come usually at a certain meeting.
Yeah.
Maybe just put when that is, so that we know because I think they're pretty standard, aren't they?
Yeah. The Institute always is in October. So, yep, I can do that.
And maybe it's time, I know this was a great format for, we had this sort of list, just laundry list, and then we reformatted into this table. Thank you to Terry and staff for that work. I do think maybe it's time to revisit that and see if there's another way that we could do it, break something out into sort of wish list versus higher priority or recurrent, and have a section there that has some, dates or at least a quarter that we can expect to see that as a potential mechanism for understanding that and not potentially confusing stakeholders and others as to, oh, well, that's number 5. That's not a priority.
Yeah.
Other thoughts? Questions?
I'm done.
We're blazing through the agenda. I want to make sure.
Well, I guess I did kind of have a thought or question. Will that kind of lead into January where we look at the 2026? I know we're kind of wrapping the year end up. 2020 January, will we be looking at what the next year
Yeah, and I guess
looks like other than the spring
Terry
summit?
went,
2026.
I know.
Yeah,
I'm not ready to say that yet.
Yeah, we'll start legislative process probably in 2026. So it'll probably be April before we get back to this, unless I'm really good. I might be able to get it done.
But I think too, as part of that, with Patrick's point on the sort of recurring themes or issues, having the legislative dates is helpful for us. I know, I think most all of us don't lobby professionally or monitor that.
Absolutely.
So having session deadlines and other things when we can expect, oh, well, these are when we would kind of know when there's a bill, this is when we need to have decisions in and other things like that. I know that's helpful. And again, asterisk on everything subject to change and who knows what may come up, but potentially as a helpful tool.
Yeah, it seems like there's always around those dates, it's really important that you're there, like in your day job. It doesn't always align with that, but if you could plan ahead and know, like this is, and like everything's gonna be pushed through to you.
That would be helpful, I would agree with that. And I like the idea of potentially, if we are talking about making some adjustments to this table when there is time, the idea of tasks being based by quarter or mirroring our meeting schedule would be ideal. If we're hoping to have this in spring, are we like between which meetings are we looking to be involved in the summit? If we can schedule that, I mean, looking at it by quarter allows us to kind of think like, all right, this is what we're hoping to get done, or at least opened by Q1. If we have to move it to Q2, fine. But I think it would be nice to have dates that mirror the schedule of our meetings to plan for deliverables or any other extra time we need.
That's a good idea. And we have our meeting January 8th, February 5th, and March 5th. And then we have our legislative meetings that start weekly. We added one January 22nd, January 29th, but I'll cancel them if we don't need them. And then February 12th, February 19th, February 26th. And then session is over that first week in March. I think it's the next Monday. Anyway, I don't have it in front of me right now, but we will get that all to you so you all have that.
Yeah, it would be nice if this plan, especially for stakeholders, like we're sort of mirroring that schedule that we're aware of. Even if we don't meet the goals, right? Like if we're shooting for Q3 for all of this to be done, we can look at it and be like, I don't think that's reasonable. Then we move to the wish list or Q4 or whatever we're going to do. I think by looking at it in buckets like that, it might be easier to delineate what we have capacity for and what we don't.
Oh, that's a great idea. Okay, all right.
Absolutely. Every time I gotta claw the questions out of you guys, but yeah, it's great discussion. Doing great. All right. Other thoughts, questions?
I'm just curious, and piggybacking on what Emily's saying, do we want to actually have some targeted goals? I mean, do we want to set any actions, like
I love a SMART goal.
three
Big fan.
actions, something we want to do this year, just as I'm sure many of us in our day jobs are currently going through that process right now for 26. So wondering if that pertains to us. I mean, I could see where, coordinating the health summit could be one, and maybe the tour. Are there other things outside of normal work? I mean, every meeting there's, or at least the first bit of the year, reviewing bills, that type of thing. So we know that's a given. But just thinking of some of these targeted action items, we almost have those up at the top of our agenda, and we keep out a very short list of things that are realistic to get done this year. And then you can keep the other plan tracking all those other wish list or personal items that are what we call those.
So I think during legislative session, we really need to, that's our main focus, right? So, but that's a ton of work. We all know that, right?
Yeah.
So,
And that's priority.
Yeah.
I mean, that's our purpose.
yeah, so if we keep all that in that time, and then, but the rest of the summit comes right on the heel of that.
Right, so
Yeah.
is it reasonable to state that we would have a summit with all of the participatory stakeholders at the beginning of Q2 when the majority of our capacity is spent on Q1 doing just legislative review, which is the primary charge of the committee?
Yeah.
Or are we looking at like using Q2 for the time and summaring that summit,
Yeah.
another summer of
Summer.
summer.
I want
It's
a
the
summit
summit
summer.
Yeah,
Summer.
but if we plan it that way, then we're not feeling like there's this sort of thing that we're supposed to be helping to coordinate. And by we, I mostly mean you. But that if we're looking at Q2 having the capacity to do that, then then stakeholders can be aware of that as well. They're not trying to monitor what's happening with the potential for a summit at the same time of doing their same duty of legislative review and whatever lobbying has to happen with those people.
Okay. Yeah.
Not that I want to move it to summer, but that would give us the time where we begin at Q2 planning, begin planning at the end of Q1, finish planning in Q2 with the plan for Q3 to be where it actually happens.
Yeah. Okay.
Seems reasonable.
I like that, and to Stacy's point, I do like having the, when we first brought up having the sort of roving meetings and being out in the community more, and we did kind of push for that too. Let's have one on that. And I think the date got pushed back a little bit because of scheduling concerns, but I do like the idea of having a thing or two that we seek to accomplish and kind of work towards.
And I mean, thinking about dates, if we're looking at potentially going to another OSHA conference, I believe it was like June.
Yeah, that's what I just checked with Matt. It's
Right,
June.
so is that reasonable for us to do both of those things, or is it not? And I don't want to push access to care any further than we have to, because it's my primary reason for being here. But when we start to look at dates and what's reasonable, like this looks a little different than it does if it's just on paper without like concrete goal dates.
But to earlier point, if we start coordinating them around our normal meeting dates, maybe we expand the timing that day or something. We have a truncated MLAC meeting and then roll into the event. I mean, we could always have some of that flexibility to where we're not adding a whole nother day commitment.
Sure.
But maybe piggybacking some of that could work. I would love to just maybe on our list here pick the top two things, which I think we might have already heard that with the healthcare summit and the regulatory tour. And then I think definitely the third could be having our community outreach day. So those could be our three, if that's what the group wants. And then assigning the dates to those now. And that way we just have a plan.
Yes. So we know the OSHA summit, the OSHA conference is in June and it's in Pendleton. But we need to check, see if we can do that. So that's June 2026.
I want to go to Ohio.
And then the healthcare summit, that would be Q3, which would be January, April,
It'd be July to September.
July to September 2026. Okay. But we would do the planning
In Q2, but I mean, that it doesn't seem reasonable that we would have the capacity to plan in Q1 if we're also looking at needs available for the legislative session. Because I anticipate a good number of bills related to things workers' compensation might.
How many do you anticipate?
I don't know. There's a lot going on.
I'm like,
in
is there
healthcare
something
right
I
now.
need to know
No,
about?
I think I'm just thinking about like in response to what's changing in healthcare.
4,600.
Yeah, 4,500 specifically, supported by ONA. Like, I'm just anticipating it. Yeah.
Okay, let's see, okay. And then for regulatory, what works best for those groups is kind of that fall season, does that work best for them to maybe be doing that for us? Like, does
I
that
think
fall
it's
well into our
very good.
plan?
DCBS divisions, right?
And it seems like it would make sense to do the regulatory tour prior to the summit. The more that we understand about who does what and how, the better we might be able to look at solutions for problems that are incredibly complex.
So,
I don't know if that's reasonable. It just makes sense to me that if I knew more, then I could say more or
so
solve healthcare.
we skipped July, correct? We skipped the July meeting
Yeah.
normally. And so would we propose our community in June with OSHA? And then would we think regulatory for August and then the healthcare summit for September? Is that kind of
That
what?
seems reasonable.
How
Or
much
no.
lift will there be from MLAC for the OSHA visit and the regulatory piece? Will that be heavy lift from us? We're in December. That shouldn't be, it should be okay. We should be able to ask them to present by next August.
I
And
don't think that's too much.
and so then the heavy lift really would be the healthcare summit.
Yes.
Since we're helping that,
Yeah.
so that seems reasonable then, if the other two aren't a good lift from this group, besides attendance. Yeah, because that gives 9 months to plan the healthcare summit. And again, it's not gonna be just us, it's going to be. And is that soon enough? I just, when you said regulatory, I was thinking regulatory after, but however it works best for you and the being.
I mean, I feel like yesterday would be soon enough because we have some significant issues as far as access to care for Oregonians in general. However, the more planning we have and the more lead time we have, the more engagement we can get from some of the stakeholders we haven't seen be participatory, that are incredibly relevant to access to care, like some of the larger healthcare systems.
Maybe some.
Yeah, and
previews.
also some time to start to build some of those relationships or fill any knowledge gaps too for this community around some of that stuff. So I mean, that would be fine. Yeah,
Just making sure it suits.
I just think that to do it, I would rather do it right than do it quickly. And I would love to see as much participation as possible. So like I know during legislative session doesn't make any sense. People are just too busy. And then summertime in Oregon is beautiful. So being reasonable around capacity and what people want to actually get involved in, but also Greek holidays. So like somewhere in that sweet spot wouldn't be bad. And that would give some lead time for some of us who are going to be doing more engagement than other, to bother a bunch of people about this.
One question, Emily, it's not my industry, the healthcare industry, and I think OSHA's been a great partner. We picked them because it's safety. Nice fit. But is there like an industry meeting like that in the healthcare industry where we could have our outreach be there and with other people that maybe are already there? So I don't
You're
know.
more than welcome to come to our convention. We have 25,000 members in the healthcare
Yeah.
space, but we can look at getting involved with OSBN and the healthcare board, what is that, MAC? The medical
Yeah,
board.
Mac,
MAC.
medical advisory.
Yeah. Mhm. As far as learning a little bit more about that regulatory process. And then there's always OHA. As far as like how they regulate, because they would be, it sort of depends on what we want to learn. But I definitely think convention wouldn't be a bad idea, but let me think about that a little more. We have our biannual convention in Eugene in May of this year.
In Ryan's neighborhood.
Yeah.
Do that.
And even just to interact with some of the healthcare providers in the state would be a bad idea, so that they're aware of this community, other than when I talk about it. So
I feel like from the work comp perspective, when we talk about access to care, it's that it's complicated to be a work comp provider, and that limits people. And so maybe us outreaching and hearing what the difficulties are, that might be valuable.
I think the only challenge with that, while very valuable, is like really trying to decipher where the decision makers around some of this, some of these complexities lie, isn't with the direct care providers, nurse practitioners, PAs. It's with the organizations that make the decisions as far as lines of business and service. So if we can get participation from some of the larger health systems to find out from them, it's not the NPs and the PAs and then who are deciding whether or not to accept it is what we're trying to, or participating, call it accept it. But
So like a hospital association would be,
the hospital
Good,
association
yeah.
would be delightful. I do love to talk to them. But similarly, like the hospital association, OHA, ONA by a subsidiary of that, but just to be in the room, those would be very valuable to interact with us and to learn a little bit more about what some of those barriers are from their perspective.
Is there a convention timeline for any of those groups?
I'm not sure that we can look into that. I don't know if the hospital association just had their meeting or convention.
So there's late in here.
Yeah, they do a rural health summit as well. I don't know if that's anywhere in it. I can look further into that.
Yeah, I would almost propose, I love the partnership with OSHA, but I'm really intrigued with the healthcare aspect as well. If that is later in the year, perhaps we could have a second day trip where, you know, we're not incurring expense to the department, what have you, but if it is later in the year, we could have that be kind of our Q4 activity where we have a second outreach, if we can get that timed up. So we could continue on with OSHA in June, the regulatory tour in August, the healthcare summit in September, and then depending upon timing of the hospital group or the rural hospital group that you have, maybe that could be October, November, whatever that timing is, tentative, if that could maybe be our backup, or maybe not full committee, but whoever's available to go, an optional group or something if we wanted.
I do think that a convention with the hospital association or the Rural Health Summit would be more valuable than my ONA convention, even though I think my ONA convention is wonderful. Again, we're looking at having conversations with stakeholders who are the decision makers around some of these barriers or access, if you will. So
I wondered about the urban and rural, if we needed to maybe do something twice, you know, so that we make sure that.
I mean, I definitely think in the healthcare space, there are very different problems coming to a head, if you will, in the rural space versus the urban space, definitely as far as viable access. And that would mirror when we're talking about a healthcare summit where we're involving stakeholders that maybe go beyond our scope. I would agree, access in rural areas is going to be a larger problem than in urban areas.
Yeah, and we heard that during the subcommittee, the difference between the urban and the rural.
Right, as far as access to different modalities for management and getting workers back healthy and ready to work again. That was a lot of information really fast.
I'll echo. I like your idea, Stacey. I think there's some years if there's time to, especially with how prominent I think that access to healthcare is going to be, to have double outreach, to have all the information leading up into the big session of 2027. I think that's important.
I was trying not to think about the big session.
I know, just kidding. We're gonna see what your record bills you can read.
Yeah, I'd imagine it's going to continue to center around like healthcare and access to care. I mean, it affects every single industry and every single Oregonian. So.
Yeah, I really like the idea of double outreach, and perhaps we all have an agreement where we'll figure out amongst ourselves, we have at least half of us at each one, and just have that commitment, but that there's probably gonna be grace where we might not be able to meet both. But we can probably all coordinate that together to at least have half of us there at each one. So, do I have this right? OSHA in June, regulatory in August, healthcare summit September, and then Emily will let us know about the best hospital one to connect with, preferably in the fall, is when I think we plan on.
It depends on when.
Depending upon timing,
it depends on
obviously.
when we find
We will
access, but yeah.
accommodate, but if the one is later in the year, that might work ideal.
I imagine the hospital association is gonna have a thing in Q1 either because it's legislative session.
Exactly.
Exactly. Yeah, I have fall Q4. Perfect.
Yeah.
That one. Okay.
Or something like it, yeah.
Sometime, and we can figure out how to make it work.
And that would all work on one page and one table.
Well, that's still, I mean,
Those are
Yeah.
our targeted.
the state of reform might be a good one. I think they come annually. That's, I just attended that conference. There's a lot of people who would be, yeah, that one might be a good one.
Other-
Barb Anderson has her hand up.
Oh, yep, thank you, Barb.
Good morning, everybody. I don't know if this really is relevant right now, but when you were talking about all the outreach coming up next year, the year after regarding access to care, I'm not sure how many workers would be participating in this, or it would mostly be medical providers. But I did just want to point out that we are seeing an influx of workers who are refusing even to attend medical appointments right now because they're in fear of ICE. So my thought is we're probably going to, I'm sure it's a specific demographic that this is going to apply to, but I'm sure we're going to be seeing even less participation from the public in some of these outreach events, whether they're rulemaking or these types of meetings and stuff. But that's just something to be aware of.
Absolutely. Yeah, so I can do some outreach to make sure that we have representatives that feel comfortable speaking the interests of those community members. Thank you, Barb. That's an excellent flag. I think telemedicine, another connection there as an access concern with the situation federally for what ICE agents are doing, I think would be a good follow-up. I know that telemedicine and other things, access, were addressed in the subcommittee. Sorry, I'm looking at you because you're my subcommittee. For all of your work, and if there can be any kind of an update or additional information. Does DCBS or WCD currently have resources and information? I saw the notice on the door as we walked in. Is there information on WCD's website for worker protections and access in the context of
Telehealth.
threats to getting access?
So I can speak, at least from the OSHA perspective, what we've done. We historically would hold a Spanish language worker safety conference. For the reasons that Barb just highlighted, we opted this year instead to go with a handbook approach and are using worker advocates to help with that distribution. It's also allowing us to publish it in more than just 2 languages. So we're even hitting a larger group of audience. And I believe, Matt, you've got a presence in that handbook.
Yes.
Yeah.
Some information that.
So that's one technique that we've come up with. It is a continuing point of discussion. How do we reach that particular community, given the federal regulatory environment? We see them as being a highly vulnerable population in all the areas in which we regulate. And so we've been thinking creatively about how to do that, mostly through partnerships. Particularly the Mexican consulate has been a great partner for us to help get and meet with that community in a safe space, and then our worker advocates as well.
Great. Thank you.
Okay. I'm thinking about providers and insurers and how that relates to telehealth for reimbursement and regulatory stuff. Right, we can't dictate per se, but looking at my thoughts.
I think it's a crisis created, I think, by the federal administration, and making sure that the systems that we have that are set up are able to address that, I think, is important and
It's
urgent, obviously.
Yeah, it creates like yet another barrier as far as the utilization of telehealth and like adding another layer to the complexity of providing care for providers who don't already utilize telehealth or who have not historically needed to use telehealth due to the physical modality nature of like the treatment.
Yep.
So, okay.
You can't do physical therapy solely over telehealth?
No, but you actually probably could do more than you think as
Yes.
far as providing support and training on home exercises. Same thing with OT, right?
Yeah.
Changes to home environment can be easily recommended via telehealth, but the challenge is making sure that those providers have that technology, are comfortable utilizing it, and are still being able to be reimbursed in the same way that they would be in person. Right, because we want the system to be fair for everybody, including the providers and the insurers. So, okay, my wheels.
Correct.
Scott, so CIS is a health insurer. So we actually have a virtual physical therapy program implemented a couple of years ago, and it's super successful.
Yes.
And it's with you. It's cheaper than in person. We mail them an iPad. It's like some kind of tablet and sensors. And then you do everything over video conference, and then it measures. And apparently it's more successful because a lot of people go to physical therapy once and then stop because it hurts them, or they don't feel comfortable, or it's like time out of their day. So it's been a real successful program. I don't know if you can do everything.
I mean, it's like Wii, right?
Yeah.
You can bowl at home. There's a lot of really great technology out there as far as being able to access rural communities, especially rural communities. The challenge with connectivity becomes an issue as well. But it definitely, the extension of telehealth benefits. I would love to learn more about if there are any limitations with, again, the reimbursement structure as far as the way we regulate visits, and if there's anything that can be done about that as far as ensuring that, again, that it matches, that people are able to access it in the way that's most safe and comfortable for them, and that the insurer or the provider is able to be reimbursed in the same way. There's certain changes in the way that you build telehealth with CPT codes versus in person. That we could look at that. I guess some of that might be manager role, but we could still.
Great, thank you. Yeah, and interesting. It makes sense to me, having been through physical therapy, of what you perform in the visit versus comfortably performing it in your home the way that you will over repeatedly through therapy. I do see Barb has a hand again.
I was just going to bring up the fact that, I mean, we know that there are telehealth options and stuff, but we're even talking like IMEs, workers not wanting to attend IMEs, or like I said before, even going to work, or requesting hearings or anything for fear of really going anywhere. But anyway, it's just more barriers that the federal government has created, and it's just such a big topic right now in the conversations that we're having with workers. So I just wanted to bring that to the forefront of everybody's attention if they were not already aware of that.
No, agreed. And I think it's a great point. And I know some of the earlier discussions that we had about intimidation from certain employers and others for filing claims and everything else, and the work that we can do to kind of provide wraparound. Like, we have an exclusive remedy. We want to make sure it's the exclusive remedy. We want to preserve that as the exclusive remedy. And we need to make sure that we don't say this is the exclusive remedy and here's a giant wall with barbed wire and everything you have to, overcome to get to that exclusive remedy. If it's the exclusive remedy, it needs to be accessible. So I think, yeah, exactly. Great point.
It broadens the scope of people we should connect with as far as the home care association, right? You have community providers who are already there doing physical therapy and other various modalities in the home setting through other areas. There's not a reason we couldn't explore that as well. The physical therapist has the same degree, whether they're a home care physical therapist or if they're an outpatient physical therapist. It might actually significantly expand care and support the difficulties home care and community-based care are having with reimbursement right now in general, since CMS is being stingy.
Great point.
Yeah.
Thank you.
Including IMEs, right? Especially if you're looking at PAs and NPs being able to expand their at some point.
Anything else? Plan related? I feel like I have to be the going once, going twice. Probably should. So upcoming meetings, I see January 8th, February 5th, and March 5th. These will be virtual only. Then upcoming legislative meetings, we have slated January 22nd, 29th, February 12th, 19th, and 26th.
Those are hour-long meetings, remember?
Yep.
MLAC's 2 hour, legislative's 1 hour. So, and everything's virtual at this point, pending the move. So, and I know I definitely have a conflict March 5th. Okay. Thanks.
Great. Anything good to the order? I would say I know the holidays are a very hard time for a lot of folks. So just making sure that we are in a place to listen, even when it seems like we don't have time, and making sure that folks are aware of 988 and suicide support as much as possible. So I know in the construction industry, there is an increasing tradition of really being concerned about mental health. And that's something that we're really proud of and that we're trying to take forward and say it's okay to not be okay, and to talk to people and reach out for help, and get creative with technology and having, being able to text 988, having like joining calls when you have someone who's called you, getting creative in the ways that we try and support people around us. So just wanted to make a point of that, and also say thank you so much for everyone on MLAC, all of the work that you do. It's really appreciated. So, all right.
Said.
Well,
Great year.
all right. Well, that said, we will see you next year.
Lots of goodies in the back of the room.
Yep.
Help yourself. Thank you.
I really love you folks.